First, though, we spoke about Justin Timberlake's Lyme disease earlier on with Lucy. So, Amir, what exactly is it?
Yeah.
How does it affect you? How do you deal with it?
Yeah.
Like, I've heard of it. I don't know very much about it.
Yeah, so it's a relatively rare infection, but it is an important one. It's caused by a bug called Borrelia burgdorferi, which is found in ticks. So when ticks bite you, sometimes in the UK countryside, we see it across Europe and North America, they can pass on this bug. And initially, what you can get, in 78 to 80% of cases, you get a typical rash, which looks a bit like a bullseye. It's got a red dot in the middle and a red circle around that dot. And then after that, you can get a flu-like illness, you can get swollen glands and painful joints. And that is the acute phase of the illness. If it's caught early by the GP, you might have a blood test to diagnose it, and then you're given antibiotics, normally doxycycline, to treat it. A week's or 2 weeks course of antibiotics is enough. For some people, they can go on to get a longer version of this illness, and it's called post-treatment Lyme disease syndrome, which is what Justin Timberlake has got. Now, we talked yesterday about this nociplastic pain where it sends your nervous system into haywire, and even small amounts of light touch can cause pain. And that is what can happen. It can inflame nerves, it can inflame blood vessels, it can inflame joints, and it can lead to this chronic pain, brain fog, extreme exhaustion over a long, long period of time. And that's really hard to treat. There's a lot of supportive treatment rather than direct treatment. And that, unfortunately, is what's happened to Justin Timberlake, Avril Lavigne, Shania Twain. So it's really hard. There'll be lots of people watching this who may well have that, and it's hard to manage.
And can you get better from it, though?
It's hard. It takes time, months, even years. But yes, treatment options are limited.
Absolutely. So get the doctor as quick as possible.
Yes, if you think you've got it, get the antibiotics.
Yeah, absolutely. Goodness me. Right, Amir, our bodies.
Yes.
They start to change, don't they?
They do.
Once we hit our 40s.
We don't like it, but they do.
And beyond. So you've got your Midlife Clinic today. You're going to help us all out.
I'm going to try.
Yes, of course you are. And we're going to start with skin, hair, how to keep them looking healthy, glowy.
Yes.
How do we do it?
Lots of women will know as they enter the perimenopause and menopause that their hair may well thin and their skin
100%.
changes.
Yes.
This happens because estrogen actually keeps hair in something called the anagen phase. That's the hair growth phase. So the hair stays on your head for longer and it grows for longer. It also improves blood supply to the scalp, estrogen does, so your hair's getting all the nutrients. As you enter the perimenopause and menopause, obviously estrogen declines, and lots of your hair follicles will enter something called the telogen phases when they start to fall out.
Great.
Yes, so you might notice when you're brushing your hair is thinning. Collagen is the other buzzword everybody's talking about. It's the most abundant protein in our body. It helps keep our skin nice and healthy, plump, smooth. It helps with our joints and muscles, also the inside of our blood vessels. Now, collagen declines 30% in the first 5 years of the menopause, which is huge. And that's why the structural changes of the body happen to women. So the kind of things you can do, absolutely HRT. If you've got symptoms of the menopause, HRT is the way to go if you can have it. But there's some natural things you can do. The first thing to do is protein. You need to up your intake of protein as you enter that age.
So important.
Normally we would say you should have about 0.75 grams of protein per kilo. So for an average 70 kilo woman, that's about 56 grams. As you enter the peri and menopause, you need to go up to about 1.2 grams. So you should up it to about 80 to 90 grams of protein a day. So it's a really big increase. Omega-3 fatty acids, so we're talking about oily fish, chia seeds, flax seeds, walnuts, help keep your skin shiny, plump, gorgeous, and with your brain as well. Vitamin C is really important for absorption of collagen and protein, as well as iron. I talk about iron a lot. People may have normal levels of iron, but they could have low normal levels of iron. Normal levels of iron are really wide. The range is really wide. You want to get right to the top of that normal range to have healthy hair. So really, really up your iron intake. So we're talking about red meat maybe once a week, fish, eggs, lots of dark green leafy vegetables as well. Get them into your diet.
When I take a iron tablet, I drink it with orange juice, actually. I remember
vitamin C.
Exactly, just to sort of double up on that.
Yeah.
Can you overdo it, though?
You can do. Your body's quite good at getting rid of it, but you can overdo it if you're taking lots and lots. So I wouldn't worry too much about that. Zinc and biotin and hydrate. Your skin needs lots of water as well. So get all of these things. Protein is the big one, though.
Proteins, that's incredible. And we talk about supplements, and I mean, there's so many out there.
Yeah.
It's so difficult to choose, and you hear, like you say, these buzzwords of what you should be taking. Do they really help?
Right. The ones that do help, vitamin D, you do need that for structure in your hair, your skin, your muscles and bones. Definitely take that. Take it alongside some magnesium perhaps, and omega-3 fatty acids. Yes, there's some evidence that they help as well. For things like collagen, I know everybody's selling them, I know they're everywhere. There's very limited evidence that taking whole collagen works. Your body just can't absorb it.
Right.
You are better off getting it from your food and getting your body to build it itself.
Right.
If you are going to buy collagen, hydrolyze with vitamin C is the way to go. But unless you're deficient in things, you don't really need a supplement, you need food.
And that's down to a blood test then with the
Yeah.
doctor, really,
Yeah,
isn't
if
it?
you've got
If you
symptoms.
feel like you're sort of lacking in something. Okay, so also let's talk about maybe women losing sex drive and they hit a certain age. What is it? Is it just life, hormones?
All of the above.
All of the above.
Yes.
Right.
So hormones. Estrogen keeps your vulva, that's the outside part
This
of the
estrogen
female
keeps
genital.
coming
I
back,
know,
doesn't it?
it's all
It's
about
crucial.
estrogen in women. So it keeps your vulva plump, moist, lubricated.
Right.
And without it, as things drop, things get drier, thinner and more painful when you have sexual intercourse as well. Testosterone levels drop in women as well after the menopause. That reduces your libido. You can't sleep, hot flushes, that can cause libido loss as well. And also body image changes too. So all of that. I would advise estrogen cream. Go and get some from your doctors, ladies. Honestly, even if you've been told you can't have other types of HRT, estrogen cream is really good at improving the structure of the vagina and vulva, your pelvic floor, reducing your risk of urinary tract infections as well. Psychosexual counselling. NICE does recommend testosterone supplements if you've got low libido and nothing else has worked.
And can you just get that at the chemist? You don't have to
Estrogen
have a...
cream.
Yeah.
You can in some chemists, yes,
Okay.
but it's always worth going to see a doctor and getting things checked to make sure it's nothing else.
And then, going with the information, obviously. Why do our bodies just change so much? Sort of, it just seems to be, doesn't it? Sort of from 40 onwards.
It does.
You start feeling...
I'm going to say estrogen again. So before the menopause, estrogen keeps fat around the thighs, buttocks and hips area. But as estrogen declines, the fat distribution changes. You get this menobelly, fat around the tummy and the inside of the organs. Also, insulin resistance increases. So you crave sugars and that can make you put on weight. Lack of sleep and stress causes your cortisol levels to rise and that can cause weight distribution issues as well. All of that is a massive issue. The key thing to do, and I can't stress this enough, is strength training 2 to 3 times a week. You want to increase that muscle mass. When you increase your muscle mass, you increase your metabolism as well, and that will help with weight loss even after you've finished exercising. We've talked about protein intake. Sleep, really important for your hunger hormones. It balances it all out. Getting a good, nutritious, balanced diet with a focus on plants and proteins, key, and stress management for those cortisol levels.
It just makes you feel better, doesn't it?
It does.
If you do a bit of exercise like that, it makes you feel stronger.
Yeah.
More capable, basically. Thanks so much.
Thank you.
Gosh, we could have talked on there, couldn't we? Estrogen.
Estrogen is the
word.
key.
It's the buzzword. Thank you very much, Amir.
Looking for more health and wellness content? There's plenty more right here on our channel. How about you check out this one?